All right, I think I have this all set. I can see myself. Hi, everyone. Nicole here. I'm seeing about 25 people on the line as well, which is great. So I might get us started. Sarah, from your side of things, how does it all look? Can you see the slide deck? Okay, great. All right. Hi, everyone. Welcome to our first official MDPH orientation. We are going to try to host this every 6 months or so. Otherwise, we are recording today's session so we can put this on our website. So for anyone who's new to MDPH, who's able to attend today's meeting, and then we'll be able to send this out to anyone who might be new, kind of joining in between orientation sessions, the recording, and so people can be able to watch it offline. So I'm really grateful you're all here. We are going to work through our agenda here today. The first half of our meeting, we're going to talk just about a history of MDPH, an overview of our strategy and our structure. And then we're going to move on to the specific work groups, those activities that we have going on under each of our committees and our work groups. And then just work group expectations as well, because I know a lot of people who are here in the meeting today are either new to a work group under MDPH and are looking forward to hearing a little bit more on that. And then I will allow some time, hopefully 10 minutes or so, and we can even go a little bit over if needed to 1 o'clock for a question and answer session. If we don't get to your question today, I will also follow up with all of the answers to your questions via email as well into our big listserv. So feel free to use the chat function, the question and answer box on the webinar, or just sit tight and listen in, and hopefully we get all of your questions answered. I see everyone kind of chiming in on the chat. Thank you so much for introducing yourself. If you can, that'd be great. I think it'd be really wonderful for everyone to know who is here on the line today. We have all of our healthcare partners and our local public health agencies on the line, as well as some of those individuals from different community member groups, community members who just have heard about MDPH and want to learn more. So I'm really grateful you all are here today. And again, sit back, have some lunch, and hopefully you all learn something today. All right. I think we have a good number here. We're going to go ahead and get started. All right. I guess I should introduce myself. I am Nicole Weber. I am a program manager at Colorado Health Institute, and I help lead the Metro Denver Partnership for Health programming as a whole. And so you'll probably see me across many different committees and many different work groups, as well as administrative needs. And we're going to talk a little bit more in a little bit about the role Colorado Health Institute plays with Metro Denver Partnership for Health and all the committees that we work under. I also probably have a couple of Colorado Health Institute colleagues on the line. I see Kendra just introduced herself, and Sarah here is also been working on MDPH for a really long time, and she's going to help us answer some chat questions, as well as my colleagues as well. So if you see some answers in the chat, either from Sarah or Kendra or Rachel, etc., there are colleagues here who are part of our project and have been working on this for a really long time. So thanks for joining us, CHI team. All right. A little about MDPH. We'll start there. All right, so here is the list of all MDPH official partners. And so we got from local public health agencies to healthcare systems to regional accountable entities working on this collaborative. We have about 15 different organizations who are due paying members of MDPH, and those are those members listed here. You'll see Intermountain Healthcare is the new name for STL Health. So STL Health, just for references there. And then we have Tri-County specifically, I wanted to call out right now, it's Adams and Arapahoe counties. And so these organizations represent and serve the 6-county Denver metro region that includes Adams, Arapahoe, Boulder, Broomfield, Denver, and Jefferson counties. And all these organizations serve about 3 million Coloradans. That's about 50% of our state's population. And we work on many different things from across health equity to immunizations to social health information exchange work. And we're going to go a little bit into that. Really, we've been meeting since 2014. So the local public health agencies who are listed on this group here, on the slide here, have been meeting since then. And about 4 years or so ago, maybe 5 years or so ago, healthcare partners came to the table to really work and collaborate on health and shared priorities as well. So the partners listed here have been kind of ranging from over the past 8 years to over the past 5 years or so. But we have this really great structure and governance work that we've been using to work together over the past, specifically 2 years through COVID as well. We're going to go through a little bit about that. I want to make a note of the due paying members of MDPH. This is just a signal to the commitment that we have to our region and to the health of our communities. And so dues go to many different things. They go out the door to back to community-based organizations. They fund our time as staff members on the project. They fund your guys' as staff members' time on the project. And we'll go a little bit through what the different structures for work groups look like across the board, across the collaborative here. So why do we work together? What's the point of MDPH? And it's really because health doesn't recognize county borders, right? We live and work in different counties. COVID shone a light on the importance of us working across county lines, that these stay-at-home orders don't matter if you live in Jefferson County but work in Denver, right? And that we all kind of are affected and interrelated to the health and the outcomes that we each have in each of our regions. Climate's a great example of this, right? Like it just doesn't stop right at Sheridan, for example. It really doesn't stop up on I-25 where our county borders are. And it's really important for us to think about how we work together and why we work together. And it's really about pooling resources and affecting health outcomes for our community. This is our vision and mission here. We really can't achieve our mission of improving population health without strong and multi-sector partnerships. And so the individuals and the organizations listed on the previous slide really are really important to coming together across the different sectors between regional accountable entities, CCHA and Colorado Access, affecting priority populations such as Medicaid members, to our large healthcare systems who serve our communities all over the board, not even just in Denver metro region. All of us have a skill set and a role to play in improving health in the Denver metro region. In addition to those members listed on the previous slide, MDPH also works alongside regional leaders in human services, education, the health alliances in the region, community-based organizations, philanthropy, government, et cetera. And so although they weren't listed specifically on the slide before, we cannot do strong work without having collaboration across the sectors that really influence health, the social determinants of health, et cetera. And so we work informally and formally through work group structures to work with all those different sectors. And as you work alongside some of these members throughout your time working on MDPH, for those of you who are MDPH official organizations, for example, you're going to see individuals from DRCOG or the state health department or from the schools on different work calls, because it's really important to work together. So just to reiterate, our vision is improved health in Metro Denver through regional collaboration. And we do that by building partnerships between our agencies and across our sectors to increase capacity for achieving our vision. And I hope our new logo shows this, demonstrates our commitment to collaboration and partnership and being together across the Denver metro region. So this is our new brand. If you haven't seen it before, you should probably be seeing this on any slide decks moving forward. And we are really excited to launch this today. Okay, so how do we decide how to work together? How do we decide what our shared priorities are? How do we decide what work groups to implement? How do we decide what maybe to comment on in a letter or on a policy agenda, for example? What it comes down to is 3 principles that really guide the work that we do under MDPH. The first principle is that healthcare, public health, human services, and all of our other partners can have greater reach and impact by working collaboratively across the region and contributing unique skills and strengths. And so, right, we can do a lot more when we work together, when we pool our resources, and more importantly, when we pool our expertise, when we can learn from each other, when we're able to figure out what our best practices. Those are the things that we can do to make sure that we can really reach our populations where they want to be met and how they want to be met. The second is that we really, really hope that aligned activities enhance the work, but not replace your own work that happens at individual organizations. For example, you all have your day job, right? You all are doing things maybe related to community health assessment. And what we want to do through MDPH is make sure that we can make it easier for you to do that work, that you can learn from your partners across the region, that we can kind of advocate for the things that need to happen with change to make your life easier day to day. And so I hope that this guide dog is a great representative of that and helping guide that work as we move forward. Really, we hope in general that regional approaches are designed to minimize the burden on community partners, that what we do is all in one, that we can kind of reach out as one organization under MDPH. And lastly, probably the biggest and most prominent principle that you'll see throughout our work is that collaboration across shared priorities, including creating common goals, will have greater impact by leveraging existing priorities of individual partners. So what this comes down to is that we utilize and start with the results from your public health improvement plans, from your community health needs assessment, your community health assessment data, to assess what are our common priorities. What are the things that we all agree are really important for our region that we have across the board? Does Centura Health find that behavioral health is a barrier? They're finding behavioral barriers with their communities, as well as the same as Tri-County Health Department, as well as Boulder. Those are the places that we start with our work and assess how can we make impact when we work together across those shared priorities. So when we go over our structures with the work groups, you'll see that these are the areas that our leadership, the historical leaders of our group and our current leaders of our group, for example, have found that there's common shared priorities with, and that's why we decide what work groups those specifically are. I'm looking at the chat. Please want to make sure I don't see any questions, so I'm going to continue. Thanks, Sarah, for that support. So, what does it look like? What's the structure? How do we actually implement those shared priorities that you saw on that last slide? Well, in 2020, we went through a revamped governance process for working together across our sectors. Since historically, MDPH was just the local public health agencies, we had a different governance structure that was relevant for maybe a couple years ago. But now that we have all of these new MDPH due-paying members at the table, what does it look like to decide those shared priorities across our sectors? What does it look like to say, we're going to fund community-based organizations to do an ambassador program? So we developed a new governance model. It has been piloted or been running since 2020, since COVID. And this was a shared decision between all of the MDPH members as well. So hopefully everyone on the line was a little bit a part of this decision-making as we developed this governance structure. What we wanted to do is make sure that our governance structure increased transparency and clarity around roles and responsibilities and what we do together, and really ensured sustainability of our work long term. Overall, the governance structure is a backbone organizational structure. And what that means is that Colorado Health Institute is contracted to help facilitate and navigate and do the administrative requirements to make sure that the collaborative moves forward. That also means that, Sarah and I and the other CHI team members here are here to help facilitate decision-making for all of you, to help you kind of move forward through the process about what's next, what are our shared goals, what does it look like to implement those goals? And that's the kind of the role that CHI plays here. In general, we're going to go through the slide next about the structure. There's two levels of work that we have. The first is a committee level work, and the second is a work group level work. In general, committees provide strategic direction for the work groups, but they do not have decision-making, day-to-day decision-making over those work groups. So they're tapped for maybe funding ideas, for strategic scope of work building for the next year, to really support direction and ensure that we're not missing opportunities to improve health in Denver. A really good example is behavioral health. We have some strategies that we're working on behavioral health with that work group, but the committee is really here to think about what are the other ideas, what are the other interventions or needs or barriers or missing pieces to address behavioral health in Denver Metro that we can work on through a regional collaborative approach. And so for those of you who are involved on these different levels, you'll see these types of conversations happen across committees and the different work groups. We do about focused strategic planning sessions and scope of work building for the next year in the fall. And so coming up this quarter 3 and quarter 4, you're going to probably hear from us a little bit more about what does it look like, what's our scope of work for 2023, and you'll see the committees are the places that we have those conversations, but the work groups are the ways that we actually actualize that, right? How do we actually do the intervention? So this might clarify some of those pieces that I just mentioned. When we say MDPH or Metro Denver Partnership for Health, we mean the entire umbrella of MDPH. There might be two different lanes that we're referring to MDPH on. One lane is just our local public health steering committee. That's what LPHA stands for. And the second is our regional collaborative committee. So we'll start with the regional collaborative committee in the blue, and you'll see across the slides, the blue is some of those results that we hope to see, or the work groups under RCC. That's the acronym we use for regional collaborative committee. And green, you'll see those are some of those work groups that we have for the LPHA side of things. So the RCC is a place where we can have a shared platform for leadership and capacity building and networking for those cross-sector work groups, activities, et cetera. So that includes where all of our healthcare partners, where all of the RAIs and the local public health agencies come together to decide the scope of work, what's within our shared priorities. This is a place where we have specifically work groups that serve or that have members from across all of our different sectors. So we have a work group on immunizations, we have a work group on behavioral health. The community planning or community assessment work group is on pause right now, but it's on here because it has been meeting over the past year. We have a health equity work group and a social health information exchange project. That is not just a work group, it is many different work groups and many different advisory groups underneath that, and we'll go through those in a second. Next, we have our local public health agency steering committee. That is just where the local public health agency directors meet. Right now, they are meeting twice a month, and the regional collaborative committee meets quarterly. Our second quarterly meeting is actually on Thursday. So for those of you who want to learn more about the RCC, I can also let you know who is the leaders from each of your organizations sitting on these groups. We have 3 chairs under the regional collaborative committee, and there's 2 representatives from each of your organizations, from each of the official MDPH organizations sitting on the RCC, a primary and a secondary. And the LPHA side, we have 2 chairs, and they meet, as I mentioned, twice a month, and includes usually the executive director and the deputy director from all of the local public health agencies, as well as the chief medical officers in the region. And so there's a little bit of a mix there, a mixed bag, especially with COVID, but that's kind of the overall structure and the differences between the 2 groups. And so then under the local public health agency steering committee, we have the specifically LPHA only work groups, where it's just the local public health agency staff members sitting on that. That includes a schools work group for COVID. We had many other work groups under COVID as well. Currently, it's just schools and maybe resource navigation, but we had work groups on testing and containment and monitoring. I think there was about 12, I think we counted at once, work groups under that scope, but right now we just have schools. We also have a climate change work group, a healthy beverage partnership, which is a really interesting model and really sustainable. And we'll talk a little bit about the differences between those models in a second. And we have an early childhood work group that is meeting really in connection with some of the other work that's happening across the state with human services and early childhood and maternal and child health. But right now it's a little bit of a mixed bag with that work group. And then, as I mentioned, CHI is that we staff some of these work groups. We are the backbone to multiple of these work groups. We are the backbone to both committees. And so you'll see here, the cross-sector work groups right now, as it currently stands, CHI has been contracted through grants and dues to really lead some of these work groups. When I say lead, it's facilitating, it's convening, it's making sure that we stay on track with some of our deliverables, the project management side. But then the MDPH local public health agency staff members are actually the backbone of many of the local public health agency work groups. And I'll talk a little bit about that in a second, but that's kind of the difference between who leads what and where we're at together. All right, I think I see no questions. The last slide in this section is our goals. Right? And it's why we work together. It's all the things that we hope to do under MDPH. And personally, I think we have been working on. For those of you who sit on MDPH work groups, you have received a survey on work group satisfaction last week, and you'll get a reminder from me today. But it's really about these goals. Are we helping increase respect and trust and commitment across all of our partners in all of our regions and our roles? Are we helping improve partnership and collaboration across our sectors? And these are the things that we want to measure with that work group satisfaction survey. But we have other ways of measuring some of these other goals. For example, are we having clearer voice, a louder voice in public health and healthcare in Denver metro region, whether it's through letters, whether it's through assessing who's able to attend our meetings, whether it's just knowledge of who we are across the region. We also want to make sure we have improved data. We also, probably most importantly, want to make sure we have reduced burden on our community members and our community by having one voice that they can go to. When we're all reaching out to different community for assessment information, for feedback on a survey, for focus group data, we can really put a lot of burden in our community if we're not coming at it in a coordinated and collaborative way. And that's really, at the end of the day, what we hope to be able to accomplish under MDPH. And with all of these goals in mind, with improved reach, improved funding streams, increased alignment, at the end of the day, our goal is improved health outcomes. And we are working on that through community assessment processes together. But that's our goal, right? We just want to make sure our community is healthier and happier and lives longer. So I hope this slide kind of gets a little bit clearer there, and you'll see some of these measures coming across your desk over the course of your time spent on working on MDPH. All right. Thank you, Sarah, for your help monitoring. We are going to move on to our next section about specifics about the work groups, the activities that we work on, and your expectations if you actually sit on a work group or a committee under MDPH. We're going to go through the work groups that you saw on that structure slide. And so we're going to start with the Regional Collaborative Committee lane, that cross-sector lane that meets quarterly, and these different work groups meet at different intervals. So the first work group that we're going to go over is health equity. Health equity historically was actually under the local public health agency only lane. And so there was just the local public health agency staff working on different initiatives, from a health equity guide for MDPH to webinars to information sharing, etc. And as of this year, as of 2022, we have decided to move this work group under the RCC lane. And this is a great example of how we did a strategic planning sessions in the fall to really determine what's our scope for the next year. So right now, we've relaunched Health Equity Work Group. We have a new CHI team member helping lead that summons, so you should see her name come across your desk. And they're going to be meeting monthly for a little bit moving forward, and probably bi-monthly after that. They have subgroups, sub-work groups under that. They have a new charter, a new charge, new work group expectations. And for those of you who sit on that work group, you should have a little bit clearer vision of those expectations and needs through that charter and through that letter of commitment process. For those of you who do not sit on that work group, their goal is to achieve health equity and environmental justice across the Metro Denver region, and to embed equity at all levels, including in leadership and within decision making. And this work group is unique in the fact that they are working on to incorporate health equity under MDPH, but also across the region. So it's not just about improving health outcomes directly with our populations and our communities, it's also to really make sure that what we're doing day to day with community engagement, with our scope building, with our getting feedback from community, embeds equity at the center of all we do. And so this is an exciting project. I'm really glad we're getting up and running again. And it was a nomination process to sit on this work group. Again, it's 2 individuals from each organization under MDPH who sits on this. And this is why it's a little bit more of a formal group in that decision-making process who sits on it, only because of that need to really embed equity in leadership and decision-making and all that we do here. So I wanted to highlight and start with this group, especially as it gets started and up and running again. Our next work group is immunizations, or IZ, as you'll see across the slide deck. This is specifically a work group that got uplifted during COVID-19. Originally, it was to focus on improving flu vaccination rates, and now it's working on both flu and COVID vaccination rates. We had been working specifically on increasing immunization access, really helping support the state on that priority process about who gets vaccines at what time through COVID. And then it has kind of transferred and moved into an ambassador model. And the ambassador model is something that we have in our behavioral health work group as well. So I'll just put that on the slide here. What we are doing through the immunization work group is paying community-based organizations to help promote trust with the community and to promote different communication tactics. So they might be putting things on social media related to vaccines. They might be hosting community roundtables about vaccines. They could go to events and have a table and talk about behavioral health and stigma or mental health or access to mental health. And so this model, ambassador model, is quite new for MDPH and actually is a place that we're going to be thinking about sustaining and changing and making kind of grander, right? What does it look like for us to work with community and community-based organizations moving forward? So you will probably hear a lot about the ambassador models. We have final reports and outcomes about what it looks like to work with its community partners, to pay them to meet monthly with us, to really guide us about best practices for our priority populations. It's really exciting model, and I wanted to make sure I highlighted this clearly because you probably will hear this across many different things. So the behavioral health work group has kind of two sections to it. We have a behavioral health work group that meets monthly, but under that program, we also have the mental health ambassador program, which that goal is to reduce stigma associated with mental health among both African-American and Latinx populations. So we, again, pay and partner with community-based organizations to really promote those messages with their community and address stigma. It has been a great project, and we're going to continue both the ambassador programs under this model for the next year to come. Behavioral health work group also works on other things, whether it's related to access or substance use or education or letters. You'll kind of see things, different things kind of come across the board outside the ambassador program, but the ambassador model is probably our most funded piece that's under that work group. The last work group is social health information exchange. And this is a much larger project than some of these other work groups that's here, but technically the social health information exchange work sits under the RCC and the Denver Metro Denver Partnership for Health. Their goal is to really help address unmet social needs more effectively and efficiently by connecting healthcare, human services, and community-based organizations to coordinate care. And if you'd like to learn a lot more about our social health information exchange work at CHI and MDPH, we actually have an entire web page. We have an entire webinar on it, and we will send it out afterwards with the recording to this presentation as well that goes on our website. But take a look at that information. They have different work groups. They meet with community. They have a yearly meeting with stakeholders to move this work forward. And it's a really exciting project to really get people the connected care they need, whether the social health needs they have or the healthcare needs that they have. And so we're going to send the link to that afterwards. And Kirsty from CHI and Ashley help lead both of those groups and some of those groups under that, but they lead the initiative as a whole. And so if you'd like to learn more information, I can also get you their contact information. Nick, I see your question. Thank you for that. Are there ways to view notes from other work groups? That's a great question. So as of now, we share our files under the Google Drive, and we can think about sustainability and long-term about what we want to do to share information and knowledge and materials across different work groups. But for now, I can always share the Google Drives that we have under that. I don't want to crowd your inboxes with all of our work group minutes every time, but if anyone's interested on being the listserv, I can always add you to the listserv where we send the meeting minutes out afterwards. You don't necessarily have to be a part of the work group there. That's a great question, Nick. And then I also wanted to add, after every regional collaborative committee, we send out the slides, and at the end of the slide deck is an update from every work group. So on Thursday's meeting, I'll make sure that everyone can kind of get an update from those slides. We have updates on actually all of these work groups in that slide deck, so you can get an idea from the last quarter about what happened and what occurred. Brian, are the work group committees full, and do you need more people to be involved? That's a great question, Brian. So I answered a little bit about health equity. To answer about immunizations and behavioral health, those are very open to whoever is interested in working on those different topics. And each work group is structured in a different way. So each work group is open or it's closed. And so health equity currently is a nominated process, it's a committed process, and so that is not open, but immunizations and behavioral health is open. So if you're interested in working on those, if you're interested in learning on them, let me know. We'll add you to the meeting invites. At this point, these three top work groups meet monthly. Social Health Information Exchange has multiple work groups under it, and they meet a little bit differently, different process. I'm fairly certain they are. I'll let Kirsty answer at some point. I'll follow up with a question about who is able to be invited, but I think it's also kind of a closed process for them as well. And thanks, Sarah, for getting everyone's information set to go. And so, Brian, it's up to you if you're interested in any of these topics, and we have charters, and so you can kind of get an idea for all the activities and work that they do. I'll go through the local public health agency only work groups. Again, at this point, it's just the local public health agency staff. So climate change. Climate change has been meeting for quite some time and has gained a lot of momentum over the past 6 months. I'm really excited for them through the legislative session. They've been great advocates in creating a policy agenda for themselves and working on different things from data, shared data indicators for climate change, all the way to what it looks like to collaborate on different interventions across the region. Their goal is to increase awareness of the impact of climate change on health through both capacity building, policy development, and communications and outreach. And so they have a whole breadth of what they do. And we have our friends at Boulder County Public Health leading the charge there. It's really, really exciting work. I'm very proud of what they've accomplished and the voice that they've brought for public health to the legislature through this process and all of the climate change legislation that's gone through. So I think it's really a great example of that collective voice, the collective impact that we can put on there. Our next work group that we have listed here is early childhood. Again, as I mentioned, they're a little bit on pause, but they're really working with Family Connects and a lot of the other work that's happening under social health information exchange work on there. And then for those of you who are involved in the RCC, you'll learn a little bit more on Thursday as well. So early childhood, their goal is to support maternal and child health initiatives, including prevention programming and collaboration with other regional efforts. So in general, it's MCH level work here, and we have the local public health agency MCH staff involved. I'm going to just double check I'm following the list here. I think we're good. Everyone's just putting their interest. So thank you.
Great. So yeah, please continue to use the chat, and we're tracking all of it. So thanks, everybody.
Yeah, thanks, everyone. Our next work group that I wanted to highlight is COVID-19, and it's not really just a work group, it's just all of the COVID-19 work we do under the local public health agencies in particular. And what I want to highlight is both the work groups. So we have a schools work group who is meeting monthly at this point to really support schools through mitigation and containment processes. What does it look like to help them kind of assess when schools close? That happened probably a couple of years ago at this point. At this point, it's changing about like, what does it look like to support parents potentially in education and prevention programming? So things have changed quite a bit over the past couple of years, but I'm sure many of you on this line have been involved in some of these COVID work groups. And honestly, some of these COVID work groups were under also the RCC lane, that blue lane over here as well. And so it wasn't just the local public health agencies, but at this point, as it stands, mostly just the current work groups that are running as local public health agency work. We also have done a lot of COVID work under MDPH with the executive directors and with leadership staff. So you've probably seen some press releases or notifications come out from MDPH over the course of the past couple of years. All of those press releases and notifications are on CHI's website. And we also try to put them out with your communications teams at your local public health agencies. So we are very well connected with your PIOs, your public information officers, and working through these different processes. We put out a pediatric vaccine campaign back in November. That was really exciting. There's a lot of different work that we have going on under this. If you have any questions about COVID-19 work, we have an entire webpage dedicated to the COVID-19 work. So we'll send that off as well and the follow-up email. If you just go to the Metro Denver Partnership for Health webpage, you'll see a box and a call out on the COVID-19 work. And lastly is our Healthy Eating Active Living work, or as we call our Healthy Beverage Partnership. Healthy Beverage Partnership is a funded program under the CCPD program at the State Health Department. That's the Cancer, Cardiovascular, and Pulmonary Disease Grants Program. They have been working on healthy beverages for quite some time. That includes both policy issues as well as working with restaurants to promote healthy beverages with kids' meals, for example. And so they have been really, really active in both the policy and education agenda, and it's been really, really great to work with them. So technically, they do sit under MDPH, but I'll show you in the next slide their model. It's a little bit different than the work groups here. As it stands, I think they're the only work group listed here that potentially might be closed, but we can always follow up with the leads there as well to make sure that we have the right people at the table. Their goal is to address health inequities an unhealthy childhood weight experienced by children in communities of color through the Healthy Beverage Partnership. And so as you'll see here, a lot of the work that we do under MDPH, our focus is on priority populations, and those are most vulnerable or have adverse health outcomes when we see in the data. And so really what we want to do and make sure is that our communities are getting their needs served, their health addressed, and in an equitable way. And so that is the overall basis of all the work that we do. And our last 5 minutes or so, I just want to go through a little bit more strategic understanding for you all to know what the work groups and the expectations are for these work groups. We have 3 models of work groups. The first model is a model that's pretty sustainable, that Colorado Health Institute and the staff here really don't participate much in. We're here to support strategic direction if needed, kind of build connections and bridges, do any kind of level of support that potentially need. But the work group really kind of runs on its own. It's fully grant funded. MDPH partners take the lead. When I say MDPH partners, I mean all of you, right? You take the lead on strategic decision-making, on activities, what are the interventions? And really we're here to just kind of build bridges and make connections and kind of elevate anything that you potentially might need related to policy or communication. And so that is Healthy Beverage Partnership, and that is why they're funded under CCPD currently. So that's the work that's happening under Healthy Beverage Partnership there. Workgroup Model 2 is the model where most of the work groups sit under. They are a blended funding of grants and dues from Metro Denver Partnership from Health Partners, whether it's from donations or grants that we apply for ourselves. It's just kind of a mixed bag of how we fund the activities that we work under. MDPH Partners, so all of you, provide in-kind support. You're not paid to sit on these work groups, but you provide support in so many ways, right? It's like we can't do this work without you sitting at the table here. The difference actually is that Workgroup Model 1 is that MDPH Partners, their staff members, their FTE is paid for under some grants. And so each year we assess, do MDPH partners, do they need their staff FTE? Do we need to figure out where grants or dues could fund some of this? How do these models potentially change where we could have kind of a blended model here where it's not just CHI providing staffing, but maybe all of you potentially providing staffing. And this is something that we decide at both the RCC and LPHA steering committee level. And we have those discussions every year to assess what is the budget, what are the needs, does your staff need FTE, how can we make sure that everyone feels confident to actually implement the work that we need to do. So that's where health equity, social health information exchange, behavioral health, immunizations, and all the COVID-19 work currently fit under. I'm going to make a caveat, like an asterisk that's not on this page. We do potentially pay for some community members' time to sit on advisory groups, for community-based organizations time. And so we do try to make sure that we have funding to be able to do that as well. So for those who are not, this isn't their day job, right? And if they have to kind of sit on focus groups or advisory councils, we make sure that we have some budget for that. The last model is Workgroup Model 3, where there's no specific MDPH funding currently. There might be kind of here and there for different activities, but there isn't like a dues process example for specifically the work groups to implement the work. And that's currently climate and early childhood. Everyone who participates on this work provides in-kind support. And there's no reason why none of these models could all move to Workgroup Model 1. And that's really the ideal vision, that we can have sustainable long-term funding that everyone can use to implement this work and make sure that's actualized. So these are in flux, they move all the time. And we want to make sure that us at CHI can help promote that if we identify a grant that we can apply for to support your work group activities, that's what we want to make sure we can be able to do with your support through MDPH and the partners that are there. So they move, they're in flux. We are totally in support with making sure that people get the funding that they need to make the activities happen. All right, and then our last couple minutes before our question and answer session, here are our expectations. And each work group has different expectations, different principles that the group has agreed to, different activities. But this is kind of an overall expectation that we would presume if you sit on even the committee level or the work group level. The first is that we expect you to actively participate in the work groups, right? They meet at different timelines, some meet monthly. All of it's been agreed upon by the work group that currently sits on there. So I hope that that makes sense. And also through our work group satisfaction surveys, we're trying to figure out and assess if it's the right timing at the right timing to meet over the course of the year. We also expect everyone who participates in MDPH to champion and actually implement and actualize the activities identified by the work group, right? That you're a voice for the region, that you're a voice for your organization, and that we implement what needs to happen through the action items identified. And that's the third bullet that you see here. The fourth bullet is to help us identify funding opportunities. We can't move across the spectrum unless we have all hands on deck, right? That everyone here has identified, oh, this could be a great potential funding opportunity, whether it's a grant or a donation from a philanthropy. There's all these different places that we can identify funding opportunities, and we are excited to kind of help support you all through that process. If you have feedback for the facilitator or the chairs under work groups, let them know, right? We're here to help promote that. We at CHI are the facilitators of the work. We are not the chairs of the work. And so each work group has different chairs identified, and they help provide the strategic direction. So if you're more comfortable talking to the facilitator or the note taker as the CHI team, or if you're more comfortable talking to the chairs and the subject matter experts, great. We don't mind, but we want to hear from you. We want to make sure that the work that we're moving forward is applicable and appropriate to all the work that we do. And then lastly is if you're transitioning off or moving organizations or positions, just let us know, let leadership know or the facilitator know. And if you've identified a new person to sit on the work group, it's helpful for us to make sure that our listservs are updated, to make sure that you all aren't getting notifications for things if you've moved on different roles, and just to make sure that all are represented across the board if the organization so chooses to be represented on a work group. So sometimes when someone might leave an organization, we lose that historical knowledge, which is a-okay, but we want to make sure that we can kind of fill that back in again to make sure that you're represented in your region, your community, your jurisdiction's voice is being represented on that work group. And if anyone has any other specific expectations or norms that you want to add, feel free to add them to the chat. I'd love to hear from your perspective. If you've been working on these work groups, what's worked well, what you might expect from your colleagues, from your peers. I'd love to hear what those are in addition to this. And feel free to just add them to the chat. I see some questions coming in, so I'm gonna just feel free to add them to the chat. I'm gonna go to our questions slide. And just start answering some of these, but feel free to add them into the chat. So that's our overview of MDPH. I hope it clarified some of these pieces for you all. And now we have about 10 minutes or so for questions and answers. I think I've turned off and muted everyone, so please feel free to use the question and answer section of the webinar here or the chat here, whatever you're most comfortable with. So I'm going to start with Nick. Question about grants and proposals. Does MDPH have its own 501c3 status? That's a great question, Nick. And no. So MDPH does not have like an official, we're not like an LLC, we're not a nonprofit. We utilize the processes that we have in place through all of you as nonprofits or CHI to apply for applications on behalf of MDPH. And so what happens there is we might identify a funding opportunity and a local public health agency is only eligible to apply. What we do is make sure with the grant funder that we could potentially apply on behalf of the region through a local public health agency, and they'll apply for that. If it's a nonprofit who's eligible, CHI is able to apply on their behalf. And if it's a health system, we also have the healthcare partners on the table. So I hope that clarifies. We just kind of determine eligibility. And again, if the funding opportunity allows us to actually implement a regional process through that grant opportunity. Indira. I'm just going to read your comment out loud. There's a recommendation for the health equity work group. They developed a team charter. Perhaps each work group could have a team charter that they use to operate. This would help with consistency. And I think that's a great point, Indira. And I think at this point, we have a charter for pretty much every work group. There might be some COVID ones that we didn't fully get to because it was the capacity that we had at the time. But that is what we're here at the CHI. The CHI team is here for. We're here to make sure that we connect the dots and that we're consistent across those dots, that we kind of address any expectations that we might need across the board, and then make sure that there's consistency, that we all work together. When I go back to this slide, there are things that overlap constantly, right? And we can't keep working in silo. And so it's important for us as chairs, as leaders, as facilitators to connect the dots between all of this group. And I think charters are a really great place to do this. Charters are also good for sustainability and making sure that everyone kind of knows what's happening, especially as people drop off. Great comment, Indira. Thank you. Other questions in the chat or the question and answer session? While everyone is thinking about potential questions that you might have, I do want to do a little shout out to our leaders under MDPH. I see some of them on the line here. I just want to say thank you so much to our chairs of the Regional Collaborative Committee. Right now, we have an opening for a local public health agency chair, but we do have Kelly Marshall, who is our Ray chair under the Regional Collaborative Committee. We have Monica Bulig as our health system chair, who sits under that. They help lead our strategic direction and meet monthly. And then on the local public health agency side, we have Jason Volling from Broomfield and Bob McDonald from Denver as our chairs currently under that work. And we're so thankful for their leadership in moving this work forward. They all rotate at different times. And so if you're ever interested in being a chair, you know if you're eligible or not if you sit on those groups. Let us know, but we kind of have a rotating basis to make sure that we have different ideas coming in the pipeline, but also to make sure that we have overlap across the chairs and ensure sustainability. So thank you all so much to our leaders under MDPH and your commitment to the region. We're really grateful we can do this work without you guys and with everyone else, but I just want to give a little shout out to our chairs.
I don't see any more questions coming in.
Okay. I see a hand. Monica, I'm thinking we can let you chat. Do you want to chime in, Monica? Hi.
Hi. Yeah, I just wanted to give a lot of credit to the Colorado Health Institute and to everyone participating. As you've described throughout your presentation, Nicole, we are reaching more people more effectively and meaningfully as a result of this work. And it could not be done without all of the people volunteering their time and without the Colorado Health Institute and your talented team. So thank you so very much.
Thank you, Monica, for that. I really appreciate it, the sentiment, and we're grateful for everyone on this line for the work that you do and the commitment to the region that you all have. We couldn't do this without working together, and I hope that we can achieve the goals that we see on that slide that I showed you previously, because we all need to be at the table to make sure that all of this happens. Thanks, Monica. And I guess you can raise your hand and I can allow you to talk too if you do want to chime in. So thanks, Monica, for that. I rarely lead a webinar, so it's great to see that that worked out. All right, well, I will close this out here. Here is my contact information if you don't already have it. I can get you in touch with any of the work group leads, any of the CHI team members, so the work group leads here internally or externally. We're here to build bridges and help bring connections together and make your life easier. So let us know if you have any questions at all. What we will do is make sure that everyone on the webinar invite will get an overview of MDPH one-pager, a link to our web pages that we referenced today, some of the contact information for work group leads, and a link to this recording. We're going to try to put it on our website for the future use. And so look out for that coming your way. And if you have any other questions, feel free to let me know. We are very appreciative, and thanks for joining us today. I hope you all have a great rest of your Tuesday and stay cool out there. Thank you, everyone.
Thanks, everyone.